hope everyone knows, the ballot of junior doctors in Wales to decide whether to take industrial action opened on the 6th of November, and it's only open to BMA members. So if you're already a member, you should have now received your ballot paper, and it looks like this. If you haven't received yours yet, you can scan the QR code that's on screen now and request a replacement. So the last date that you can request a replacement is the 6th of December. So to make sure that you receive it in time, to give you enough time to vote. The ballot closes on the 18th of December, and to make sure your votes arrive back in time, you must post it back by the 11th of December. If you aren't yet a member and you want to participate in the vote, that's great, but you'll need to have joined by the 6th of December to be included in that ballot. So, next slide, yeah. So, how have we got to this point? So health is a devolved matter in Wales, and so that the powers for health sit with the Senedd in Cardiff. So our annual pay award is determined by the Welsh Government, not the UK government. And so as part of the enhanced pay offer for the 22/23 pay year, the Welsh Government agreed to enter into separate medical and dental pay talks for the 23/24 pay year. So we entered negotiations in good faith. But despite the Welsh Government's commitment to full pay restoration that they had made previously, the pay offer to junior doctors was a sub-inflationary 5% uplift. So to put that into context, that's an uplift of just 65 pence per hour on the basic pay of an F1. This was the lowest pay offer in the UK and was below even what was recommended by the pay review body. So this offer doesn't represent a credible first step towards pay restoration. And if anything, being sub-inflationary, it does completely the opposite and is only going to erode our pay further. So it was on this basis that we rejected the pay offer. So the Welsh Government's made it clear that this was their final offer, and with no further negotiation to be had, it left us with no other option other than to ballot for industrial action. So although we rejected the offer, the government has since paid this, and what we would do is we'd encourage you to save this back pay to cover for any pay lost during strike days. So next slide. I don't know if that's loaded for everyone. Yeah. So as you can see on the graph, since 2008 and 2009, we've had us receiving a 24% in cash terms uplift since then. However, this hasn't kept up with inflation. So what that means is we've in fact experienced a 29.6% real terms pay cut against the retail price index, as you can see on the graph. So the Welsh Government has acknowledged the need to restore doctors' pay to 2008 levels, and they've even gone as far as to committing to the principle of pay restoration. But when it came down to the negotiation, the final offer was only 5%. So again, it shows another real term pay cut this year. So why do we need full pay restoration? So we've outlined a couple of our primary reasons as to why it's so important. And as we discussed, our pay's decreased in real terms year on year. And now, we're in a period of high inflation, cost of living crisis. We're feeling it more than ever. And on top of this, the majority of us have got significant student debt that's far greater than that which our colleagues had back in 2008, 2009. And all of this is just further devaluing our profession. This means more of us are pausing training, leaving the profession, or moving overseas because we are just worth more than this. So the GMC State of Medical Education and Practice report in 2022 showed many concerning outcomes, which display clearly that an increasing number of doctors are leaving the profession and the impact this is having on the profession and ultimately on patient care. It's clear, we can't go on like this, and another sub-inflationary pay award from Welsh Government is only going to make this worse. So our position as a committee is, we can't go on like this. This is our time to take a stand. Doctors as well as patients are paying the price. And with the Welsh Government making it clear that this was their final offer, the lowest in the UK, we've got no other option but to ballot you for industrial action. So for us to be able to take strike action, we need at least 50% of you to take part and the majority voting to say yes. But it's really important that each one of you returns your ballot paper with a yes vote in plenty of time. You know, we don't want there to be an issue with a post or anything that's stopping these ballots getting back. So we've been clear to government that we're willing to re-enter negotiations if a credible offer is put on the table, which begins to address the pay erosion. But the more of us that vote yes, the louder that message is to them, and the more power we have as a committee to negotiate you the best pay rise we can. So I'll hand over to my colleague to go through the rest. Talk to you about strike action.
Thanks, Pete. If you just mute. So yeah, as I say, my name's Oba. I'm one of the co-chairs of the WJDC as well. And I'm essentially going to talk to you a bit about what the actual logistics are of the strike itself. So many people probably wondering exactly what strike action will look like. We've not announced a date as of yet, but you may have seen on the ballot papers that the earliest date we can ballot is 8th of January 2024. And we made it clear a couple of months ago, I think, that the first round of action will be a 72-hour full walkout. So that's all junior doctors in the hospital will be walking out of every department. We'll obviously give sufficient notice to employers because they need to arrange cover. So it's our SES colleagues and consultant colleagues who will be covering us. That's what they've been doing in England quite successfully. We'll be liaising with them in the coming weeks to outline their obligations. And we're also in the process of agreeing a derogations process. And that's essentially, cover in the event that unfortunately they're not able to safely staff the wards on those days. But we'll offer more details on this closer to the time. So what to say to your employer once strike dates are announced? So they already know that the earliest date that we can strike is 8th of January, and I assume they're already starting to plan for this. I've heard people being asked if they're going on strike, so this work is clearly going underway. One thing we need to make crystal clear is you do not have to respond to these questions. You don't have to respond at all. You don't have to tell them if you're a member. You don't have to tell them how you're voting. You don't have to tell them if you're striking. These are things that can undermine the action. If you're getting pressured by managers, seniors, colleagues, please just tell them that you've been informed by the BMA that you don't need to answer these. If need be, if you're getting more pressure, direct them to us or tell us and we'll get in touch with them. Once the strike has gone underway and you return to work, you must respond truthfully if they ask whether you're in work or not. That's because there are deductions if you're on strike. So after we've gone on strike, please be honest with your employers, managers, colleagues. So pickets. Pickets are slightly more complicated than many people think. So this is essentially where people in the union in a trade dispute are near or on site in the workplace. And the traditional definition of this and reason for this is actually to prevent people from going into work. I think as of late, it's become more of a demonstration of support, really. You have the legal right to picket. Let that be clear. No one can tell you not to picket. We've not announced dates yet, but we're trying to organise now. So we want to get pickets at as many work sites as we can. There's a code of practice which recommends that no more than 6 people are on the picket line. So it's important that we plan for this well in advance. But what we can do is we can hold demonstrations outside of hospital grounds. So this would be open to everybody, and this will be open to you regardless of where you actually work. This would allow those who aren't eligible to participate to join. Would have no limit to the number of people that could join. So for example, GP registrars, because our dispute's not with GP practices, if you're on placement as a practice, we'd encourage you to attend demonstration at your nearest site, as opposed to picketing at your workplace. And if you do plan on joining a picket on the day of action, please let us know. There's a QR code on the screen which you can scan, and I'm sure they're showing the link in the chat right now. And that's so that we can make sure that we plan properly, but also importantly, so that we can stick to this code of practice. So there are several groups of doctors which have unique concerns and challenges. One of those are international medical graduates, or IMGs, who may be working in the UK on a health and care visa. And obviously you'll understandably have concerns about industrial actions. You are entitled to take part in strike action if you're in the UK on a visa. But it's important to understand how unpaid and unauthorized leave might impact your visa, and what you need to do. And it's quite complicated, unfortunately, but we have extensive guidance on the website. So again, if you scan that QR code or if you click the link in the chat, we'd be more than happy to support you. We'll also post the email address at the end, and you can email there with any of your queries. So there are some members who unfortunately can't participate in the ballot or strike action. For example, registrars working in public health who have honorary contracts, or a document which implies an obligation of labour to your placement organisation. Similarly, academic trainees who hold contracts with universities, they're not able to ballot or take strike action. And that's because taking part in strike action when you have an obligation of labour to another organisation, for example, your host organisation or your university, that's known as secondary action, and it could have an impact on the validity of the whole ballot. If you think you've had a ballot, but you're not eligible to take part, please get in touch at this email address. It's incredibly important. Medical students, we've had a few queries about, unfortunately, because you're not employed by the NHS, you're not eligible to participate in the ballot or strike action either. Please follow the guidance from your university. However, there are ways that you can support the strikes, even if you can't actually take part. As we mentioned before, you can come and visit the picket line or demonstrations. If you're feeling generous, we'd be grateful if you bring us some hot drinks or snacks. You can also take part in the demonstrations, as we said, and bring others as well. Showing support on social media. We've got the X or Twitter usernames on the screen at the moment. And you can contribute to the strike fund, and spread the same message amongst your colleagues, your family and friends. That fund is there to help those who would be unable to take part in strike action for financial reasons. So it is, appropriately apportioned to certain people, but anyone can contribute. You don't even have to be a doctor. And yeah, there are many ways that you can get involved. This is the drum that we've been beating for the last few months, really. To be successful here, we need every single doctor to get involved. We need everyone to help. I think our committee is made up of about 30 members, spread across Wales, but we need grassroots membership to help, whether that's posting on social media, talking to your colleagues on WhatsApp, joining the strike groups, sending emails out, anything you can do, putting posters up, wearing the lanyards. It makes a huge difference. And that's why we saw the massive results that we've seen in England and Scotland. But we've outlined a few key things here. So we have a campaign page which has all the events so far and has an FAQ section. You can register to become a pay activist. So that's essentially a group of people that we're gathering together in a more formal capacity to contribute. So we'll have your contact details, etc. So things like pickets, organising locally in the workplace, we can contact you directly. Please post materials online to social media. It probably sounds a bit silly, but it actually makes a huge difference for people to see these things. And then distributing the campaign materials. So badges, lanyards, posters, I'm sure you've seen them all around. We have hats as well. They're free. They're free to everybody. So please just go on the website, have a look, and order as much as you like, because you can make a massive difference with it. Good. Diolch, and thank you for listening. We've got a few questions that were sent in before the webinar, which we'll go through, and then we'll take some questions live.